Children's Hospital and Medical Center is one of our community's most treasured assets. My father was fortunate to work with many of the outstanding and caring employees during his 40-plus year career. The Spirit of Caring Nursing Award fulfills Dad's wish to honor and pay tribute to the wonderful pediatric nurses at Children's. Dad was widely admired for his passion and devotion, and in turn he admired the nurses at Children's in whom he put his trust for the care of his patients. When our family has the pleasure to meet the individuals who are selected for these awards, it confirms the special asset we have in our community. This is a simple way to say thank you for the dedication of the nurses and all of the employees at Children's.
I have the best job in the whole wide world. Critical care transport is really the best combination of emergency and critical care nursing that I've ever seen.
She was not responsive at all.
You have very intense moments with your patients that you only meet them for very brief periods of time.
So as soon as I finish doing this, I'm going to call the hospital, let them know how you're doing, and we'll get you ready to go, okay?
And then you hand them off to somebody else. I think part of the art of transport is knowing that you're walking into a situation where it's often a really difficult day for these kids. I think building trust is really important if you're going to take good care of them and make them comfortable along the way. Getting down on their level, making yourself not so scary, which means being willing to be silly, which is actually probably the most fun part of the entire job. I didn't necessarily grow up thinking I was going to be a nurse. I love science, so I always thought I would do bench science or research of some sort. But then about halfway through school, I took an EMS course and fell in love with emergency medicine. I've traveled around the country since then. I've been a nurse for almost 20 years.
Just that constant education and the constant diligence to push herself proves what type of person she is. She doesn't assume that she knows what's going on, even though she has all these years of experience behind her. It's fun to see her bring it to the team because she has that marriage between the paramedic and the nursing role. She's just great to get to work with. She's kind, she's compassionate, she's intelligent, she's inquisitive, but yet she's so humble.
She treats her patients the way she treats her colleagues and the way she treats people in general. She cares about the human experience, and it's reflected in every move she makes. Emily is definitely a go-to resource on our team. She serves in our shared governance. She's the subject matter expert when it comes to evidence-based practice, when it comes to research. She can go on a call with two partners and take care of a critical patient and bring them back to Children's and have a spectacular outcome, and she'll nominate them for an award. Emily is always shining the light on her colleagues.
She exemplifies exactly what Dr. Robert A. Murphy did when he took the time for the patient at the bedside before discussing care, just to let them be a kid. And she does that.
Just really grateful to the Murphy family. To recognize nurses like this is a gift, and it means a lot to me that people can recognize someone trying to give good care. But I also am very grateful to the people around me that have enabled me to be able to give that good care to a community that bought an amazing ambulance, to a hospital that supports a transport team.